Hi guys, so today I'm joined with Roy Hammoud, our famous chiropractor from the London Back Pain Clinic. He's recently recovered from sciatica. He started it, and I think it was in 2020. So we're going to find out, the experiences he went through, how he diagnosed it himself, if he actually practiced what he preaches. So Roy obviously sees a lot of patients who suffer from sciatica. So we're going to find out if he gave the exercise that he did. The therapeutic treatments that he would give to patients if he did them on himself. So let's see what he got up to. So, Roy. So first of all, let's explain what is sciatica.
So sciatica is it's the condition where someone is experiencing leg pain coming from their lower back, right? So usually there's a problem in the sort of lower back area that's compressing a nerve, usually the sciatic nerve, and that's causing symptoms or pain shooting down the back of their legs.
Oh, fine. So how did your sciatica episode start?
That's a good question. So back in...
Was it too much manipulations?
No, nothing like that. There's too much deadlifting, actually, so I would say. So back in 2019, I would say I was a sort of an avid gym goer, or sort of used to go to the gym regularly, focusing a lot on heavy lifting, let's say, right? So the problem with that is eventually your technique will sort of tend to suffer, right? If you're trying to lift too much weight, you put your back at a bit more of a risk of sort of injuring it. So it was probably mid or early 2019 Feb where I was going for a very heavy deadlift, relatively speaking, for me.
How much was the weight?
180. So it was heavy for me, and that was my 1 rep max at the time. Now I knew I wasn't feeling too good that day. I don't think I'd warmed up properly. My legs were feeling tight, I was angry at something. And so, so I thought I could definitely do it. And I went to the weight.
You thought you'd get your aggression out on the one.
Exactly, yeah. So I went for it. I started to pick it up, and I immediately knew that it wasn't going to come up, right? So you just know when a weight is too heavy for you. But what
did you wear a belt or anything?
No, it wasn't.
Okay,
no
fine.
belts. No, it was just me. Me and the bar basically. And at that point, I knew I should have let it go. I should have just stopped. Said, "Look, it's too heavy. Just leave it. Try it another day." But I kept going. So as the bar started to come up, I started to round my back forward. As I got to the top, I knew something was wrong, put it back down. As soon as the weight came back down, that's when I felt sort of my back that's when I experienced a whole bunch of back pain.
Okay.
So at that point, I kind of knew something was wrong.
Did you have to crawl out the gym?
I kind of did, actually. I didn't experience all the symptoms at once. At the very beginning, you're sort of experiencing a lot of cramping and a lot of, acute pain.
Yeah, fine.
So at the time, you don't really know I didn't really know what I did. I just knew it hurt. And yeah, I couldn't continue with the exercising, and I had to sort of, leave the gym that day.
Fine. So did you leave the gym immediately, or did you try any other exercises afterwards?
I tried to continue exercising, but the pain was too much, and I just wasn't able to carry on with the exercising at that time. So I just sort of crawled out.
Fair enough. So what did you do when you got home?
I iced it, I tried stretching. I tried to sort of, relieve myself in any, in any which way, hot pack, ice pack, try and move around, try and stretch it out, just try and relieve it a little bit.
Fine. So was it an actual disc bulge that you suffered, or was it just a trapped nerve due to muscle tightness?
No, this was an actual disc bulge.
Fine.
So, and I realized that a few days after when the leg symptoms started to come on.
Okay, fine. And could you stand up straight? Because normally when you get disc bulge, it's quite difficult to extend your back completely for at least about a week.
Yes. So I was in pain for about 3-4 days.
Yeah.
I was in acute pain for 3-4 days until it sort of subsided a little bit. I was able to become a little bit more functional, a little bit more movement, but nowhere near what I was able to do sort of previously. You know,
Did you go back to work? Did you see patients that week?
I was.
Is it?
On the next day, I think I was seeing me.
Did you take any medication?
No, not at the beginning. No.
Fine.
So I sort of suffered through it, you know.
Okay, fine. So you realized it was a disc bulge causing the sciatic irritation. So then, what did you do after that?
I think I just felt sorry for myself for like.
Why you went back to work?
It was like, what else could you do, you know? So, and actually, no, and this is where I didn't practice what I preach, because what I did was I didn't do anything about it from a sort of therapeutic or trying to get better standpoint.
But you said you put ice on it.
Well, just a little bit, you know.
Okay,
that will sort of help relieve the symptoms, but that didn't really get me on the road to recovery. That didn't. I iced it, but then never took the next step.
Fine.
Probably for about a month afterwards. You know?
Fine. So guys, how we found out Roy had a disc bulge was because me and Carl walked in the clinic one time. He's just doing planks every single time we walked in. So Carl was another practitioner at the London Back Pain Clinic, and Carl just asked him, he's like, "What are you doing?" He's like, "Oh, I've got a disc bulge." And we're like, "Why don't you tell anyone?" So that's how we found out. So
yeah, I just kind of kept it to myself.
you really feel sorry for yourself. Fine. So you found out you had a disc bulge. You came back to work.
Yeah.
Yeah. You didn't practice what you preach in terms of therapeutic first initial rice treatment. And then what happened after that?
I realized there was a problem because it started to affect my quality of life. Right?
Okay, fine.
So I couldn't exercise anymore. So that was something I used to do sort of regularly. So every time I would try to sort of exercise, it would flare up, it would hurt again, and I wasn't able to do the things I normally would do or enjoy to do. Right?
But when you say exercise, do you mean that you couldn't do your normal routine or any exercise?
Normal routine exercise.
So
that's a good point, because anyone who has a disc bulge can exercise.
Yeah.
I think the mistake they make is they think they want to go back to what they originally were doing pre-injury, as opposed to modifying it.
Fine.
Right?
Which they can go back to, just you have to get the treatment right.
Absolutely. You have to know what caused the injury in the first place.
Yeah.
And modify the exercises to where you can exercise without aggravating your back, right?
So you didn't go back to doing 180 straight away?
No. I don't think I have gone back to doing 180.
Did you go back to doing a deadlift at all during this inflammatory problem?
No.
Okay,
no.
Fine.
So I didn't.
So what did you do to treat it now?
So, well, let me backtrack a little bit. So I didn't do anything for it for about a month, you know, just sort of feeling sort of sorry for myself and sort of suffering along with it. And then I remember one day a patient asked me if I was limping. And I said, was I? I was like, I didn't know I was limping. But it was at that, they sort of said, are you limping? Oh, you must have had like some sports injury or something like that. And I went, no, I hurt my back like a month ago, you know. So anyway, it was at that point I knew I had to.
Did he come in for his back?
Probably. Yeah, why not? But here's, so what I did, about a month after, I sort of decided, okay, maybe let's start working on it. Let's start trying to, the first part, and this is the sort of most important part, you got to create or think about a management strategy and try and figure out what things work, what things don't work for you as an individual, and sort of slowly get back into it. It's a slow process to recover.
So that's what we do in our initials. We create outcome measures initially. It's like an outcome measure.
Correct.
Right? Fine.
Correct. But it's easy to do it on a patient. It's hard to do it on yourself, because that actually requires you to sit down and think about your life and what you're doing and what you can and can't do and how to plan it out, you know.
So what was your cans and can'ts and do's and don'ts?
So I couldn't lift weights, number one. Every time in that month where I was feeling sorry for myself, every time I tried to lift weight, particularly if it was anything that compressed my spine, so putting a squat rack on my back, a squat bar on my back, doing a deadlift, anything that was a little bit too compressive with maybe a slight bit of sort of bending forward would aggravate it. So I had to sort of eliminate those types of exercises, right?
So a lot of compound exercises?
Not with weight, especially, and not at the start.
Fine.
I could do it with body weight, so
Yeah.
I could do, or very light weights. So instead of using sort of barbells, I sort of went down to sort of body weight squats or, very light kettlebells. And eventually you find that limit where an exercise doesn't hurt you, right? And then that's where you start, right?
Fine. So give us an example. So, okay, give us an example where you tried to do it, you couldn't do it, then you had to adapt it a bit. So which exercise did you adapt?
Well, number one was walking. I mean, I couldn't like forget exercise. Like, even take a step before that, I couldn't walk for more than 20 minutes.
So how did you walk for 20 minutes? You walk with the limp?
Well, I would have to start to walk with a limp, or I'd have to stop and rest. Right? So my exercise, the first thing I did was sort of get on the treadmill and try and figure out how long could I walk for before it would flare up on me.
Fine.
So, and I think at the start it was about 8 minutes. So that was my first thing that I did. I'd go in, I'd walk for 8 minutes, and I'd go out, right?
Fine.
It helped. Walking does help with disc problems in the back, right? It is a sort of therapeutic thing that you can do. Where people sort of get stuck is how much they want to walk, right? So if you can't walk an hour, don't walk an hour, try 30 minutes. If you can't walk 30 minutes, try 20 minutes,
Fine.
And I had to figure out what my sort of limit was, and at the start it was 8.
Fine. So, but the thing is, obviously, to walk more than 8 minutes, the inflammation has to calm down. So,
correct.
You just not going into the inflammatory stage, calmed it down.
Yes.
Okay. So
yes, you have to not bring it to the inflammatory stage, right?
Okay. So, how did you know you were able to walk for more than 8 minutes? Did you just think, all right, let me just give it a go, or did you think?
Yeah, I mean, I would set targets for myself. So I'd say, right, I'm going to walk for 8 minutes a day for a week, right?
Fine.
And then after a week, I'd say I would try 10, right?
Yeah.
And then I would sort of set myself weekly goals. So from 8 minutes, try 10. If it didn't flare up, great, I'm still on 10. If it flared up, okay, stay on 8 for another week,
And did you have stages where it flared up, then you had to go back again, or was it always just a continuous forward pace?
No, I would make mistakes, So sometimes I would try too much, and this is the point with life. Sometimes life gets in the way, Sometimes, I think I had to.
Well, sometimes you had to run for a patient because you're
late. Exactly, run for a patient or pick something up that I wasn't sort of thinking about, right, and that would flare it up.
Fine.
That's fine. You sort of take a step back, recalibrate, and continue sort of moving forward.
Fine. Did you have any treatment, or was it just a self-management program? Because it sounds.
So yes, I did ask Carl, sort of colleague Carl, to sort of help me out a few times.
Sure you want to go to him? I'm kidding.
Well, now, in hindsight, no, he's all right, Carl. But yes, he did help me sort of from a manual therapy perspective. So what he did was allow me to move a little bit better, loosen things up, make me feel a little bit easier, and that allowed me to keep going.
So he did some soft tissue work, I assume,
Correct.
Probably some joint mobs.
Correct.
Did he do any manipulations or anything?
He would manipulate my back, yes.
Fine.
So it did free it up, sort of.
So this is a physio doing manipulations.
I know, right? Go figure.
Fine. Okay, that's good. So how long was the treatment episodes for with the manual treatment?
So the manual one, I mean, again, it was as often as I needed it. I think we started weekly, once a week, because that's all like we had time for. And then as it got better, or as I needed it less, we sort of spaced them out, once every 2 weeks, once every 3 weeks.
And then in terms of your physical exercise, you just managed that yourself to figure out, okay, I can only, do, let's say, a back workout, which include weights for 10 kg at this point. Now let me see if I can do 12 kg. Okay, so
Correct.
You managed that bit yourself.
Yeah.
Okay, that's fine. So how long were you ready to go back to a decent weight, let's say deadlift?
Well, it took a while, but I was quite slow and measured in my, the key is you never want to rush back, right?
Yeah.
So you only want to go back when you're sort of completely comfortable, and actually when you're stronger than you were previously. So I think the one thing that the back injury taught me was, just because you can lift something heavy, it doesn't mean you're strong or physically fit in all the right places, right? So while I could lift or try to lift 180 kilos, I didn't have much of a core, right? I didn't have much sort of glute activation. So that was the sort of next phase of my sort of rehabilitation or recovery, which was finding out why that injury happened and build on those things.
Okay,
so for
fine.
example, for me, it was lack of core strength and lack of glute strength,
Okay,
right?
fine. So you went back to do more of those type of activities to try to improve that.
Correct. So after the walking,
Yeah.
as the walking started to improve and I got to say 15 minutes, 20 minutes,
Yeah.
you know, I'd walk on a treadmill, so bring the incline up on it as well, you know, just to make it a little bit more challenging. I would slowly start to incorporate planks. And the one that I think saved me was the side plank, right? I think that was really helpful for me in building my sort of torso to allow for better stability in the spine.
Okay, that's good. Okay, fine. So now you're back to how are you now? Are you back to full recovery? Are you?
Yeah, I'd say I'm fully recovered.
Has
I'm
patient noticed that you're still walking with a limp?
Maybe. Maybe on Fridays or Saturdays or whatever. But no, no, I'm back to full sort of function. I don't think I'm as fit as I used to be, but it has nothing to do with the injury. Right?
Okay, fine. So how much of this was your self-management and how much was external management in terms of going to see someone?
I would say it's 50-50. Right?
Okay, fine.
You need both sides
Yeah.
to sort of be able to progress forward. You can't. The self-management can only happen if you're not in pain or you're not in too much pain, right? So you need the treatment, you need the care of a professional sometimes to sort of get you in the right sort of frame or stage, and then you go away, do your homework, build yourself up a little bit, and then you can go back, get a little bit more treatment, then you can go back, right? So it's a sort of like I don't think you can.
Bit of a mix and match.
Yes, yeah,
Okay,
yeah.
fine.
You can't have one without the other.
Okay, fine. That's fine. So, I'm glad you're better, mate.
Thank you.
Yeah.
Well, good to be better.
I wish you told us sooner. Yeah.
Yeah, it wasn't fun. Let me say that. Like, and actually, it sort of gives you more empathy with patients who do suffer with back pain and sciatica. Like, you do know what it feels like. Where, you know, even though I knew what it was, sometimes you just can't help. You know, if you've never experienced it, you miss the sort of fine details of it, right? How it feels in the morning, what it's like to get out of bed when you're feeling stiff, you know. So I was able to sort of see it, you know, get a better rounded view of this type of problem. And
did it help your treatments a bit better with the patients that are suffering with it?
Not the treatments, but I think it helped me empathize a bit more with them. So I sort of understood their pain. I understood where they were coming from, and realized that, you know, there are sort of everyone's going to experience it a little bit differently, right? So it's just about sort of knowing what it felt like, how bad it is, or how bad it can feel. And sort of, I mean, I think patients like it when you can understand them. So if you can really understand them because you've had the similar problem or the same problem as them, then
fine.
Yeah.
So you've got a new, improved, empathetic Roy.
Yes, definitely more empathy and, you know, less of a, never mind, I'm not going to say it.
So, guys, there we have it. Do you think Roy practiced what he preached? Well, he came to work with a limp and a patient had to notice it, so tell us in the comment section. But just to let you guys know, you can do this if you have sciatica, disc irritation, but just remember there's different severities of this as well. So there's a more lenient severity, more moderate severity, more severe severity. It is good to get a practitioner's an expertise approach to it, just for guidance. You may have to go see a consultant. We're just discussing what Roy did. Some things were right, some things were wrong. Don't follow everything that you said, but yeah, cool. Thanks, guys. Hope you enjoyed that. Any questions, put them in the comment section, and see you next time. Take care.